The Tai Chi school, Better Health Tai Chi Chuan, I started around 35, 40 years ago. We are very happy helping each other, teaching people in the local community, develop our Tai Chi, and we actually never really think of expanding it until one day, 21 years ago, I was in a long flight. I fly a lot, but I'm a terrible air traveler. I get airsick, I get headaches if I look at the screens. So when I fly, it was very boring. I had to close my eyes in that tiny little seat. And if I keep my eyes closed, and then I don't get airsick, and then I do my Tai Chi breathing when I feel a little bit off, it helps. So that means when I fly long distance, I do a lot of soul searching in between sleeps. And on one flight back from USA, through my soul searching, I suddenly realized, I have sent people to Tai Chi schools if they're far away from my school. And a lot of people with arthritis came back and told me the teacher doesn't know how to take care of them. And suddenly this flash of light comes to me. I'm a doctor, I have arthritis for many years. I know different style of Tai Chi. It is my job to create programs just for people with medical conditions. But we don't want this program just for them. It should be good for everybody because it's got Tai Chi principles and it will be good for everyone. So that thought take me to bring a team to work, and eventually, after working really hard to create the Tai Chi for Arthritis program. And that was the first program we created. That was the program the Centers for Disease Control and Prevention recommend for falls prevention. Arthritis Foundation recommended for arthritis. Many arthritis foundations around the world did that. The idea was a program that is easier to learn, more enjoyable to learn, safer to learn, and even more effective for health time for time. And so together with that, I love teaching. I thought at some stage I was a failure because I didn't become a teacher, I became a doctor. So as soon as I could, when there's an opportunity, I got myself trained to become a doctor's teacher. I was a clinical lecturer for the University of New South Wales. I trained graduate doctors. And I learned a lot about teaching. I love teaching. And I use a lot of modern research on teaching and learning to be part of this new Tai Chi for Health program. The way you teach is very important. We have a modern teaching method, modern medical study to prove whether the program works or not, and then we modify the program so it's much more health-orientated and safer. And this must be what people want because it took off like fire. I train trainers to train instructors, and we reach people, and it just spread. At the same time, because of demand, we do other programs like Tai Chi for heart condition, Tai Chi for diabetes, Tai Chi for kids, Tai Chi for beginners, for energy, and different programs have the same Tai Chi principle that is going to help anybody in terms of health and wellness, and easy to learn, but they're like tailor-made for different bodies, so it's more suitable, more tuned towards this group of conditions. So that allow us, our instructors, to teach different programs to different people, allow different people to learn Tai Chi and then have more tools and more programs to play with, so it's more interesting. And people do need it. The modern world do need it. And that is why we reach different health departments around the world. We teach, go through medical schools, nursing schools, communities, arthritis foundations, diabetes organizations. And we reach well over 10 million people. It's just incredibly satisfying.